name is Miriam Goldstein. I'm a policy director at HFA, and I'm very happy to be with you today to talk about Medicare. What we'll cover today is the history and general structure of Medicare and the choices that you face when you first become eligible for Medicare. That's really important because with Medicare, you'll have to make some choices right off the bat that carry through for the rest of your life. So we'll talk about what Medicare covers and what it doesn't. And what are those pitfalls for the unwary? What are those choices that you have to make that kind of limit you or bind you for the rest of your experience on Medicare? We'll talk about special considerations that people with bleeding disorders have to bear in mind when they become eligible for Medicare. And we'll talk a little bit about Medicare Fall Open Enrollment. So right off the bat, what is Medicare? Most people know that Medicare is a health insurance program for seniors and also for some people with disabilities and with some specified illnesses. As insurance, Medicare is very popular among its users, with Medicare beneficiaries reporting better access to care, lower costs of care, lower rates of financial distress associated with care, and higher satisfaction with the care that they receive compared to people who are covered with private insurance. It can come as a relief, especially for someone with a bleeding disorder who may have struggled to maintain private coverage throughout their early years, to know that Medicare is there for them. But Medicare is complicated, and that's really due to the program's history and to its structure. Medicare is over 50 years old now. It was first created in 1965, and even then it was the culmination of some 2 decades work. It was created to provide coverage to Americans 65 and up, really for acute illness and hospitalization. Medical science wasn't where it is now, and so there was much less care for people with chronic conditions. But now, more than 50 years later, Medicare covers 61 million Americans, and a big portion of the program is devoted to providing coverage for care and for chronic condition management. Medicare also is structured not as really one unified whole, but as several distinct programs, all under the rubric of Medicare. So that fragmentation can certainly leads to complexity and can give rise to some troubling gaps in coverage that it's well to be aware of. So we talked about how Medicare is really for a number of different parts, all under one label. And let's take a look at those. They're identified by letter. And so Part A is really what the original vision of Medicare was. Part A covers hospital services. It's hospital inpatient care, but it's also patient care in skilled nursing facilities, and it covers home health care and hospice as well. Medicare Part B picks up to a large extent where Medicare Part A leaves off. Part B pays for a broad range of medically necessary services that aren't necessarily provided in connection with inpatient or in-hospital care. So Part B pays for doctor and specialist care. It pays for labs and diagnostic tests. Part B pays for durable medical equipment and supplies. So things like wheelchairs, it pays for dialysis and so on. Part B pays for ambulance. And key for people with bleeding disorders, Part B pays for the injectable products that people with bleeding disorders use to treat and or prevent bleeding. So bleeding, clotting factor and other bleeding disorders injectables are Part B drugs. That's a distinction because it To some extent, they are still thought of as doctor-provided products, even though many or most people with bleeding disorders keep those products at home and self-administer them. Part C is also known as Medicare Advantage, and we'll really return to that a little later, because Part C is almost separate from the other parts of traditional Medicare. Part C is a way of getting your Medicare benefits through a private health plan. So we'll come back to that in a bit. And Part D is the newest part of the Medicare program, added in 2003, and that is prescription drug coverage. Part D covers most prescription medications that you pick up from a drugstore. Again, not those bleeding disorders, injectable products, but drugs that you may use for high blood pressure, or for arthritis, for antibiotics. Part D plans may be standalone plans, or they may be integrated with the Medicare Advantage plans that we're going to talk about separately. So, getting started with Medicare, how and when does that happen? Some people will get Medicare automatically, but others will have to sign up. Basically, you will get Medicare automatically if you are already receiving Social Security when you turn 65. But if you're not yet getting Social Security, you will have to proactively take steps to sign up. If you sign up for Medicare Part B when you are first eligible, you can avoid a penalty. And we will come back to this topic again and again because it is really important. And you can choose at this initial eligibility point how you're going to get your Medicare coverage. So how do you make that choice? What is that first decision point? The first decision point is really, do you want to go with original Medicare? And those that pathway is marked in yellow on the slide. Or do you want to go the Medicare Advantage route, getting your Medicare benefits from a private health insurance plan? And that's the route marked in green on the slide. So we'll explore both of these in a little bit more detail. So original Medicare, what does that look like? That is the path that we've talked about that was marked in yellow on the previous slide. Original Medicare brings together parts A and B, that's the hospitalization and the medical services parts. We'll talk about the cost and coverage, where the coverage gaps arise if you're going this route, and then how you fill those coverage gaps with supplemental coverage and with a Part D plan. So costs are really important, and people are going to want to know that. What are the costs and premiums and out-of-pocket costs for original Medicare? For Part A coverage, the hospital coverage, the monthly premium for most people is actually $0. If you have paid into the Social Security system, or your spouse has through the requisite years of work, then your monthly premium for Part A coverage is $0. There is an annual deductible for hospitalization of up to 2 months in a given calendar year, and that deductible is about $1,500. But then there's variable coinsurance and copays for longer periods of hospitalization. No one wants to contemplate the possibility of being hospitalized for more than 2 months, but if you are hospitalized for more than 2 months, that coinsurance and copay really mounts very, very fast and very high. So that is one of the gaps that it is important to guard against. And for skilled nursing facilities, copays vary by the length of stay. For Part B, that's the medical and outpatient services, the monthly premium for most people in 2022 is going to be $170 a month. A small number of people with higher incomes will pay more. The Part B premium did increase a lot between 2021 and 2022. That increase is actually almost entirely due to anticipated or projected cost of covering a newly approved Alzheimer's drug. And so it really was kind of an eyebrow-raising increase in the Part B premium. The good news is that the cost of living adjustment in people's Social Security payments is larger than the rise in the Part B premium. So since most people see their Part B premiums deducted from their Social Security check, their Social Security check still ends up a little bigger than it was, making up for the increase in the Part B premium. Under Part B, there's also an annual deductible of about $230, and some doctors can charge an excess charge copay. The really key thing to know about Part B out-of-pocket spending is that for Part B, you pay coinsurance of 20%, and there is no maximum cap. Now, I will keep coming back to this. Bleeding disorders products are covered under Part B. And so all of us in the bleeding disorders community know that coinsurance on bleeding disorders products amounts very, very high and very fast. And so this idea of uncapped 20% coinsurance on the benefit that covers your bleeding disorders product is really serious, and it will be necessary for you to act to protect yourself against that potentially unlimited coinsurance. So that brings us to this issue of gaps in coverage with original Medicare. And first and foremost, that substantial out-of-pocket exposure. There's substantial out-of-pocket exposure for that long-term hospitalization, remember, beyond 60 days in a given year. And the open-ended coinsurance on Medicare Part B, where bleeding disorders products are covered. Other gaps in coverage are no hearing, dental, or vision benefits under original Medicare. That is something that Congress is talking about this fall. It was something that was in the administration's agenda to fix, but unclear whether there will be political agreement that supplements, that fills this gap and provides for possibly hearing benefits. It looks like dental and vision benefits are not on the table. Another gap in coverage under original Medicare is that you need separate coverage for prescription drugs. Again, the bleeding disorders injectables are covered under Medicare Part B, but for all other drugs, the ones you pick up at the pharmacy, the original Medicare doesn't cover it. You need to get a Part D prescription drug plan. So filling in the gaps, there's supplemental coverage that can protect you against the out-of-pocket exposure, and Part D prescription drug plan that can supply coverage for those other prescription drugs that you may need now or as you age. So let's talk about some of those supplements. You may have heard these referred to as Medigap plans. These are plans that protect against that open-ended cost sharing in original Medicare. Medigap policies are private insurance plans. They are sold by private health insurance carriers, and they supplement original Medicare Parts A and B. Medigap plans are really the only way to get comprehensive hospital and outpatient coverage and financial protection within original Medicare, including covering that 20% coinsurance on Part B drugs. Medigap policies come in 10 standardized plan designs identified by letter. So if you are looking at a Part C Medigap plan, it will cover the same standard benefits no matter what the carrier is. And a really key point, Medigap plans are guaranteed issue during your initial window of Medicare eligibility. What does that mean? It means if you purchase a Medigap supplement during the first couple of months when you enroll in Medicare, the Medigap, again, these are private insurance plans. They cannot turn you down because of your health condition, and they cannot charge you more because of your health condition. That is not true later. So this is one of those traps for the unwary, making the choice of your supplemental plan during your initial window of eligibility. So what aren't Medigap plans? What don't they do? Medigap plans are not compatible with Medicare Advantage. That's when you get your Medicare benefits through the Medicare Part C that we're going to turn to. So you cannot get a Medigap policy in conjunction with Medicare Part C. They're only available with traditional Medicare Parts A and B. Medigap policies do not cover couples. So if both spouses are eligible for Medicare, each one may need to subscribe to their own Medigap plan. Medigap plans don't cover dental, vision, hearing, or long-term care. So there are those gaps again. And generally, Medigap plans don't cover Part D prescription drugs. So if you're going the route of original Medicare, Part A and B, plus a Medigap supplement, you will also have to add a Part D prescription drug plan. Let's take a look at those Part D prescription drug plans. Again, these are private plans. So they come with different formularies and different price points. They also come in with a very complicated structure and kind of a built-in coverage gap where first you meet your deductible, then the plan picks up a certain percentage of your costs. Then once you get to just over $4,000 in spending on covered prescription drugs, the cost that you pay changes, and you get, this is the so-called donut hole. On the other end of the donut hole, the relative proportion of what you pay changes again. Very complicated. And again, there is no out-of-pocket limit. Even once you get to the other side of the donut hole, you, as the enrollee, pay about 5% coinsurance in perpetuity. Again, this is something that Congress in fall of 2021 is looking to reform. They are considering a true out-of-pocket cap on Medicare Part D coverage, and that would be very welcome, and it's something that HFA supports. So enrollees in original Medicare do not have drug coverage without buying you have to buy a separate Part D plan in order to get coverage of those drugstore prescription drugs. And again, I know I repeat myself, but it's so important. Bleeding disorders injectables are not covered under Part D. They are covered under Part B. So you might think, yeah, I'll go without a Part D plan. But once again, one of the traps for the unwary, you need to sign up for Part D coverage when you first become eligible, because if you don't, you end up paying a penalty in the form of higher premiums for the rest of your life. And that's a really substantial penalty. And, when you first become eligible for Medicare, maybe you are not using any Part D drugs, and that's fantastic. But this is Medicare is a program that you are going to be on throughout your senior years, and your needs may change. So it is important to try to avoid some of these penalties that will raise your costs in perpetuity by signing up during the window of eligibility. So we talked about that first decision point, going with original Medicare or Medicare Advantage. And so far we've talked about that yellow pathway: original Medicare plus a Medigap plan to cover the gaps and the financial exposure that come with original Medicare, plus a Part D prescription drug plan to give you access to your drugstore medications. Let's look at the green path now. That's Medicare Advantage. That's opting into the private, getting your Medicare benefits from a private health insurer instead of through original Medicare. So Medicare Advantage plans, also sometimes known as Medicare Part C, are benefit packages administered by private insurers rather than the government. The government assigns your Medicare benefit to a private health plan that manages your care. And these can look a lot like some of the insurance programs that you may have been on during your working years. Medicare Advantage plans may offer extra benefits, but the key thing to know about Medicare Advantage plans is that they typically require you to stay within a defined network of providers. You cannot go to any doctor that accepts Medicare. You have to stay within the plan's network. With original Medicare, there is a cap on your out-of-pocket spending for Part A and Part B, but that cap can be high, as high of over $7,500 in the year 2022. Your bleeding disorders injectables would count towards that cap because they come under Part B, but your Part D drug spending does not count towards that cap. So you have to factor in what your financial exposure is going to be. Medicare Advantage plan availability really varies from area to area of the country. So depending on your plan, on where you live, there may be multiple plans available, or there may be few. There are $0 premium plans available for Medicare Advantage, though enrollees still have to pay the monthly Part B premium. That's the same premium that people pay in original Medicare. Coinsurance and copays do exist even with those $0 premium plans. And so again, with the Part D drugs, including your bleeding disorders products, there is typically 20% coinsurance, subject to whatever the plan's maximum out-of-pocket for the year is. But again, that maximum out-of-pocket may be as high as $7,550. Part D drugs have copays depending on the tier. Because Medicare Advantage plans keep you within the plan's network, it is really important to check that your provider is in network. So if you are interested in going this route, you're going to be looking at and comparing copays, out-of-pocket maximums, additional benefits, and whether your key providers are in network. So how do you make this decision? This is a decision you face right off the bat. Here are some considerations you might want to weigh. In terms of coverage, both original Medicare and Medicare Advantage cover the same range of medical and hospital care, including bleeding disorders products. They have to cover the same services. Medicare Advantage plans may add some additional services. Medicare Advantage plans may include those vision, hearing, and dental benefits that are missing from original Medicare. And they sometimes include things like silver sneaker gym memberships. In terms of out-of-pocket costs and supplemental coverage to deal with those costs, there is no limit on how much you have to pay out of pocket under original Medicare, unless you add supplemental coverage, the Medigap coverage. People with bleeding disorders are going to need that supplemental coverage. Unless they qualify for Medicaid by virtue of their income, then Medicaid will pick up those out-of-pocket costs. Medicare Advantage plans, by contrast, do include a yearly limit on patient out-of-pocket costs for Part A and Part B services, but that limit may be high. And Medicare Advantage enrollees are not eligible to purchase supplemental Medigap coverage to help pay the costs of those out-of-pocket costs. Medigap is only available with traditional Medicare. In terms of other prescription drugs, original Medicare does not cover them. It does cover your bleeding disorders products, but if you are in original Medicare, you are going to have to buy a separate Part D prescription drug plan to get coverage for the drugs that you buy at a drugstore. On the other hand, most Medicare Advantages fold in a Part D component to the plan. So it's kind of one plan to cover everything. In terms of doctor and hospital choice, with original Medicare, you can get care from any doctor who accepts Medicare. So you've got quite a lot of freedom. Whereas in Medicare Advantage, you are likely limited to the provider network defined by your plan, and you may have to get prior authorization or approval before you can see a specialist. It's important to note too that the provider networks change from year to year. So if you are opting into Medicare Advantage, you're going to have to check every year during the fall Medicare open enrollment period to see if your key providers will remain in network for the coming year. If travel is important to you and something that you are looking forward to doing during your retirement years, you will have to weigh whether original Medicare plus Medigap gives you more flexibility than Medicare Advantage. Again, Medicare Advantage keeps you within a limited network of providers. And so if you're planning to spend part of the year in the Sun Belt and part of the year outside of the Sun Belt, it may be hard to make that work with Medicare Advantage and a limited network of providers. And last, but by no means at all least, think about how your needs may change over time. Reports do seem to show that as people get older and as their needs may become more medically complex, that Medicare Advantage enrollees will often try to switch to original Medicare. And in part, that's because of the need to get prior authorization to see specialized providers, or because the Medicare Advantage plan doesn't have those specialized providers in network. So access barriers in Medicare Advantage that become more troublesome as people age and their needs become more acute. But it's hard to switch from Medicare Advantage to original Medicare in some cases because of that limited eligibility for Medigap. So again, if you do not sign for a Medigap supplemental plan during your first window of eligibility, in most states, they can turn you down or charge you more because of your health. So as you know, after living a lifetime with a bleeding disorder, you will experience that, what it's called medical underwriting. And so it may be hard to get Medigap coverage at a later time if if you decide that Medicare Advantage no longer suits your need. You'll be able to switch from Medicare Advantage to original Medicare, but you may find it difficult to get the Medigap supplemental plan that you need to fill those gaps and protect you against out-of-pocket costs. So if I had to boil it down, what are some nuggets of information that that would be helpful to leave you with? One is that deadlines are important. If you don't sign up for the different parts of Medicare on time during that initial window of eligibility, that may mean that you pay a late enrollment penalty in the form of higher premiums that continue for the rest of your life. That, frankly, is I think, a really unacceptable pitfall, and it's all too easy for people unwittingly to fall into that trap. So please be aware of it. Your enrollment window begins 3 months before you turn 65, and it lasts for 7 months. Part B coverage begins about 3 months after you enroll. There are lag times built in. So if you want coverage to start as soon as you turn 65, you really need to start before your birthday. On the other hand, postponing enrollment may be a good option in some circumstances. For example, if you're turning 65, but you are still working and you have what Medicare considers creditable coverage under your employer's health plan or under a working spouse's health plan, the details matter. If you work for a large company, check with your HR department. They are experts and have helped others navigate through this process. If you're not working for a large company, I'll talk in a little bit about another resource that can help provide expert advice on whether you are in a situation where postponing enrollment will not subject you to these penalties and higher premiums that last for the rest of your life. So that was nugget number one, deadlines are important. Nugget number two, take the long view. Don't just think about what you'll need this year, but think about what you'll need as you age, because some of these choices, unfortunately, once made, kind of tie you in. They are hard to unmake or to change. We talked about how it can be hard to change from Medicare Advantage to original Medicare with a Medigap plan. You can change from Medicare Advantage to original Medicare. The difficult piece is adding that Medigap plan, because once you're outside that initial eligibility window, Medigap plans can turn you down or can charge you more. And also undertaking the long view, avoid financial penalties that accrue if you fail to sign up on time. If you don't need Part D coverage now, if you don't use medications beyond your bleeding disorders, injectable, that is great. I am so glad. But if you ever need prescription drugs later in life and you didn't sign up when first eligible, you will pay higher premiums for Part D coverage for the rest of your life. And that can be a really steep burden. Okay, more nuggets. Make sure you are protected against potentially ruinous out-of-pocket costs, including uncapped 20% coinsurance for your bleeding disorder medications. So you can get that financial protection by adding supplemental Medigap coverage. If you're eligible for income-based assistance, you can get supplemental coverage from some public programs, Medicaid, Medicare Extra Help, the Medicare Savings Program. Charitable nonprofit assistance can be used in Medicare, but please be aware that manufacturer copay assistance cannot generally be used in Medicare. So if during your pre-Medicare lifetime you were using manufacturer copay assistance to help pay the out-of-pocket costs associated with your bleeding disorder product, please be aware that that assistance is generally not available in Medicare. So you need to account for that and make sure that you have protection via some of these other Medicare eligible avenues. And finally, you can get knowledgeable help in navigating your Medicare options. Your HTC social worker may be a good source of information and will presumably know if you're looking at Medicare Advantage, where your HTC is in network and where it isn't. Your HR department, if you work for a large or medium-sized company with an expert HR department, they will have helped other people navigate the transition from work to Social Security, and they may be able to give sound advice about postponing your Medicare enrollment if you are continuing to work past age 65. And then I really want to give a shout out to what are called Medicare SHIP programs. These are in all 50 states. They are free and unbiased. They don't earn commissions. And SHIP stands for State Health Insurance Assistance Programs. So they will not be experts in bleeding disorders. You will have to bring your own knowledge to them about how important Part B is and supplemental coverage to help you pay that Part B coinsurance. But they will be able to give you very good, generally based advice about windows, deadlines when you should sign up, and other general advice about transitioning into Medicare. So with that, I hope this introduction has been helpful. Really, the key thing is to empower yourself with as much information as you can as you want to make Medicare's choices that will serve you well into the future. Thank you for joining us today, and please contact advocacy at hemophiliafed.org if we can be of any assistance. Thank you very much.